Welcome back and thanks for staying with us. I'm Emily Clark.
And I'm Rick Aaron. We begin this half hour with a warning from doctors. COVID-19 isn't the only virus making the rounds in Utah. Healthcare workers are also seeing a rise in cases of respiratory syncytial virus, or RSV, which is very unusual for this time of year. The calendar says August, but Utah's RSV numbers are at winter-like levels.
Our lab-confirmed levels are sort of what we might see in early January as we're starting to buckle down as a hospital and get ready for a surge of patients with respiratory illness. RSV happening like it's happening right now is extremely unusual.
Dr. Per Gesteland, a University of Utah health pediatrician at Primary Children's Hospital, says RSV disappeared last winter as patients took precautions against COVID, but is now making the rounds, putting some children and adults in intensive care units.
So RSV tends to be very hard on the very young. It can also be hard on elderly folks, people older than 65, in particular if they have lung disease or heart disease. And it can also affect people in the middle that have underlying conditions that can be exacerbated by viral infections, things like asthma or even congestive heart failure.
RSV's cold-like symptoms can mirror COVID-19 symptoms, and the only way to differentiate is testing. Dr. Gesteland, the father of school-aged kids himself, is concerned about both viruses.
Because of the large population of children that are still susceptible to COVID-19, especially with the Delta variant raging, and now with RSV starting to pick up as well, I think there's a really, besides the COVID-19 argument alone, I think there's a really strong argument to be made for putting masks on our children when they go back to school. So why is that super important to me? Well, I don't want people to get sick and die unnecessarily. I also think there's a real chance that a surge in COVID-19, a surge in RSV might start to line up, and then you really start to put additional strain on the healthcare system.
To check the latest RSV case numbers in your county, you can go to Intermountain Healthcare's Germ Watch page. We have the link on our website, abc4.com.